Hello everyone, welcome to my channel Medicine. I'm Dr. Asma, MRCP UK. In this video, I am going to talk about one of the most important clinical session of MRCP Paces, that is clinical communication session. I'll discuss about the basics of clinical communication and how you will get good grip over this session. So be with me. In my previous video, I have mentioned that MRCP Paces has two clinical communication stations, Station 1 and Station 4, along with two systemic clinical examination, that is respiratory and abdominal examination respectively. So each station carries 16 marks and you will be given 10 minutes to complete your task. And at the beginning, a scenario will be given to you for 5 minutes. Within these 5 minutes, you have to read the scenario, organize your case, and note down important points that you should not be missed, like safety netting. So these 5 minutes is the most precious 5 minutes. At the end of the 5 minutes, there will be a bell, and immediately your 10 minutes time will start counting from now on. And you will enter into the room, there will be a patient or a surrogate. And there will be two examiners who will judge you. At the end of the 8 minutes, there will be a reminder, and at the end of the 10 minutes, there will be a bell, and immediately you will be shifted to the next case, that is systemic clinical examination. So, in between the systemic clinical examination and clinical communication, there will be no gap. And at the end of the clinical communication, there will be no crossing. So, you will get only 10 minutes to prove yourself. To prove yourself that you are a good communicator, you are an empathetic and safe doctor. So utilize these 10 minutes. And always keep it in your mind that this is not a spoken English test. And the person sitting in front of you has no medical background. So keep your language simple, use a short sentence without using any jargon. And to pass this exam, you have to have a crystal clear understanding of medical knowledge and ethical principle. You should be confident, and your body language, your tone of voice is also important. And you need to adjust those things according to the scenario. In MRCP Paces exam, you will be marked against 7 skills. And to pass this exam, you have to pass each and every skills individually. In clinical communication station, you will be marked against 4 skills. Now let's talk about these 4 skills. Number 1 skill is clinical communication skill. Here, the examiner will judge you how good you are as a clinical communicator. And please do not deliver any unnecessary information to your patient. This is not a place where you can show how much you know about a disease or a particular topic. It should be relevant, clear, and structured. Be professional and maintain eye contact with your patient and confident. Please do not make your patient confused because that may lead to future complaint. Use simple language and do not use any jargon. Number 2 skill is managing patient concern. It means this is not only about asking the concern. Please manage patient concern. Listen carefully. Do not overlook the patient concern that will cut your mark. And ask repeatedly about check understanding. That means, are you getting me? Is that all right with you? After explaining the whole concern, ask repeatedly, are you getting me? Is that all right with you? Because at the end of the clinical communication session, there will be no crossing. So you cannot explain your point of view. Within these 10 minutes, you have to prove yourself. So repeatedly check your patient's understanding. Try to convince your patient, explain your patient, and never confront. Number 3 is clinical judgment. Management plan should be sensible and appropriate, and that must be aligned with medical ethical principles. Number 4 is managing patient welfare. This is very important. You should be respectful to your patient and ensure appropriate, comfortable environment. Be and maintain patient safety and dignity. Sometimes it happens that the scenario is so emotional that your patient starts crying. At that very moment, please give a pause. Offer a tissue paper, a glass of water to your patient. And sometimes it happens that your patient is in very painful situation. So offer a painkiller to your patient and then proceed forward. Now let's talk about the layout. It has 3 parts: introduction, body, and end. Introduction and ending are almost similar for every cases, but the body part is different for different scenarios. And that will be your main task. You must act smartly to cover all points within these 10 minutes. So start the case with greetings like hello sir, good morning or good afternoon. Then introduce yourself. I'm Dr. Asma, one of the doctor in the clinic today. Your role and designation will be well written in the scenario. Use that. Then confirm your patient identity. Am I speaking with Mr. X, 30 years old, or am I speaking with Mr. X, 50 years old, Mr. X, son of Mr. Y, 50 years old? Double check. Double check with age and name. Then after confirmation of the identity, establish the rapport by saying, how you are feeling today? Or sir, I hope I am not keeping you way too long for our today's session. And after establishment of rapport, set the agenda. We are here today to discuss about your health condition. Is that all right with you? Or we are here today to discuss about your father's health condition. And I have already taken permission from your father regarding our today's meeting. Is that all right with you? By saying so, you are giving a clear impression to your examiner that you are well aware about patient confidentiality. After this, ask 2 more questions to your patient. With these 2 questions, you will get a clear understanding of the whole scenario and you will get a good grip over the station. Number 1 is idea check. Ask your patient, may I know how much you have been told so far about your health condition? Or may I know how much you have been told so far about your father's health condition? Because sometimes it happens that the patient party do not have any information about his parent health condition, or patient party maybe do not know why his parent came to the hospital, but you are about to explain the next step of management or the complications. So for a good conversation, both of you need to be on the same page. Then the number 2 question is regarding concern. Ask your patient, may I know, do you have any specific concern from our today's meeting? So at the very beginning, you are gaining an idea about the patient concern. Because sometimes it happens that you are about to explain the next management plan, but the patient is seeking about discharge. So this question is very important. From now on, you are just entering into the body part, and this part is very challenging. And you will have different challenges here. And always try to answer to your patient in a non-judgmental way. Do not offer any personal opinion to your patient and limit yourself within your scenario. The scenario may be related to a disease counseling, breaking bad news. Sometimes it may be related to a procedural counseling, genetic counseling, organ donation, post-mortem counseling, or sometimes you may have to face an angry patient due to a medical error or misconception regarding a medicine. So if the procedure is if the station is related to a procedure, then divide it into 3 parts: pre-procedure, procedure, and post-procedure. Then proceed forward. In the pre-procedure part, ask your patient to stop any blood thinning agent. Talk about the fasting hour, and then reassure your patient that the procedure will be done by an expert team. You can add or omit important points according to the specific procedure. The procedure may be insertion of an ERCP stent or lumbar puncture, colonoscopy, etc. In a lumbar puncture station, you can add fundoscopy along with it. If the patient is for colonoscopy, then you need to add bowel preparation along with it. Then go for the procedure part. In the procedure part, if it is applicable, try to draw a diagram to explain your patient. It will help in better understanding. If the station is related to lumbar puncture, then explain your patient that the procedure will be done by keeping him sitting forward position or lying on the side. We will and use wash your clean your lower back area with antiseptic swab. Then we'll numb the area so that you will not feel any pain. Then gently we'll put a needle in between the lower backbone to draw fluid, and we will do relevant test of that fluid. In the post-procedure part, tell your patient that please lie down on your back straight for 6 hours after the procedure and avoid all sorts of activities for 24 hours. You cannot drive for 24 hours and avoid flying for 1 week. Please take plenty of fluids, caffeine, tea, cola, coffee, and offer paracetamol as a pain relief medication. And inform your patient about the possible headache and immediately get back to us. And please do safety netting. This is one of the most important part of clinical communication station. Tell your patient if you notice any fluid leakage in the back part, or if you feel any fever, redness or swelling, then immediately get back to us. You can do all types of procedural attestation in this manner. And if the scenario is related to a disease or a breaking bad news, then you can choose this way. In the breaking bad news, you must give 2 warning shots. Like, sir, your blood test and imaging reports are all in our hand. But unfortunately, your reports are not as we expected. Then give a pause. Give enough time to your patient so that he can absorb the news. Then again says, I'm sorry to tell you that you have a condition known as motor neuron disease. And give a pause to your patient. After that, tell your patient that do not bother about the medical term. I will explain this to you in detail. Then proceed forward. Try to describe the pathophysiology of the disease within 1 or 2 lines. It will help better understanding of your patient. If the case is related to a Parkinson's disease, then tell your patient that, sir, due to some unknown reason, there is early aging of brain causing chemical imbalance. And for this reason, you are experiencing all these symptoms. If the patient has rheumatoid arthritis, then tell your patient that, sir, your defense system has been misdirected and now it is attacking different parts of the body, particularly the joints. If it is applicable, try to draw a diagram and explain your patient. As for example, is the scenario is related to a diabetic patient requiring insulin, then try to draw a diagram for better understanding. Then explain your patient about the clinical feature of the disease. Like in Parkinson's disease, there is a slowness of movement, shakiness of different part of the body, etc. And tell your patient in a simple language and without any jargon. Then go for the associations and complications. In celiac disease, there is association dermatitis herpetiformis. So tell your patient that, sir, you may develop itchy, blister-like skin rash in the back part of your elbow. In ulcerative colitis, you may experience redness of eye, skin rash, oral sore, back pain. Unfortunately, in a very few cases, this disease may be associated with gut cancer also. So after explaining this, go for the prognosis. In the prognosis, please do not lie to your patient. Do not give any false hope to your patient. Be truthful to your patient. As for example, if a patient with advanced CA colon who has no alternative option other than palliative care, you cannot say your patient that sir, you will be completely okay. And a Parkinson disease patient, you cannot say that sir, this is a curable one. Rather say like this, unfortunately, sir, this is not a curable disease, but we can manage the symptoms. So you are reassuring your patient also. So after this, you can go for the next part, that is the most important part, safety netting. Safety netting is the most important part of clinical communication session because the examiner wants to see you as a safe doctor. In a patient with ulcerative colitis with flare, you have to tell your patient the important symptoms regarding the toxic megacolon so that he can immediately get back to us. Our stroke patient, he has high risk of re-stroke, so tell the important symptoms regarding that. And a patient with pneumothorax, he has some restrictions for flying and scuba diving. A patient with Parkinson disease who is on levodopa carbidopa combination, please inform your patient that please sir, do not stop taking medication suddenly. These are very important information for your patient. A dementia patient should be advised regarding sir, please do not lock the door from inside. Please do not use the stove and do not go outside alone because he may cannot recall the address. So this safety netting is very important for your patient. Now let's talk about the management. It has both pharmacological and non-pharmacological management. In the pharmacological management section, you have to restrict yourself within the scenario. You cannot provide any treatment option for your patient. Sometimes most commonly it happens while the scenario is related to a warfarin, because in that case patient may want dogs instead of warfarin. In that case, you must convince your patient for warfarin, not for dogs. It is very important. Please be careful about it. You cannot advise any alternative treatment option to your patient. And always consider pregnancy and fertility issues while you are counseling a patient for pharmacological management due to teratogenicity. It is important for both male and female. And let your patient know that please inform your physician if you are planning for pregnancy. If you are planning for any pregnancy, then inform your physician that you are on this medication. Now let's talk about non-pharmacological management. Non-pharmacological management is equally important. A stroke patient needs regular posture change, air mattress, physiotherapy, and adequate feeding. A Parkinson disease patient requires laceless shoe, buttonless shirts, no rugs at home, a special cutlery, physiotherapy, and hand support near the toilet seat, etc. Now let's talk about the referral system. Referral is also important. A diabetic patient needs referral to dietitian. A dementia patient needs referral to a SALT team, speech language therapy team. So, a Parkinson disease patient, occupational asthma patient is referred to a occupational therapist so that he can uh, do some changes, possible changes in the workplace or his surrounding. Now let's talk about the social and financial support. In a dementia patient, it is mandatory to ask about the social and financial assistance because you ask about whether who is taking care of you at home, how is the health of your caregiver, do you need any social assistance, etc. A pilot with pneumothorax, he cannot fly for the time being, so refer him to the occupational physician. He will assess him and may relocate him to a desk job for the time being. And there is some social societies for social support, like multiple sclerosis societies, where the same-minded people ask and share their their opinion. So you can refer them, or you can give the website links addressed to their EU patient. And last not the least is advanced directive of living will or lasting power of attorney. If the scenario asks you to talk regarding this, then only go for it, otherwise don't go for it. But in some cases, like dementia patient, you must ask about the advanced directive of living will, because with time your patient will lose competency. So ask about advanced directive of living will. Then plan regarding the follow-up meeting, offer any brochures, leaflets, and hospital contact details to your patient, and say thank you before concluding the session. So that's it for today. I will make some prototype cases on my subsequent videos. Till then, stay safe, stay well.